and tortuous. We have seen many cases. The inferior extremity, some veins are tortuous and black color. That is called varicose vein, and it is known as varicosities. Generally, when it happens, when varicosity happens, if in any profession where long standing is required, as for example, bus conductor, traffic police, surgeon, especially which kind of surgeons requires long standing? Neuro as well as cardiothoracic. These are prone to develop varicosities, right? Now, you know, among superficial veins of the leg, the longest vein is great saphenous vein. Great saphenous vein is the longest vein in our body, right? Now, how it is formed? How it is formed? First of all, you have to know how it is formed. It is formed from, on the dorsum of the vein, there is a venous arch. On the dorsum of the foot, there is a venous arch that is called dorsal venous arch. Here, this is dorsal venous arch. Actually, you will draw by two lines. Though I used one line, but vein and artery, when you will draw, you should draw two parallel lines because this is a tubular structure. This is called dorsal venous arch, lies on the dorsum of the foot, right? It is formed by, I am drawing here, suppose this is dorsal venous arch. Here I draw two lines. There are dorsal metatarsal vein, out of four interdigital space. From each digital space, one dorsal metatarsal vein will arise. So there are four dorsal metatarsal vein. Dorsal metatarsal vein, and each dorsal metatarsal vein again is formed by dorsal digital vein. They are arising from digits. Now, suppose here you see this is thumb, then it is second, third, fourth and fifth. Now from each digit, here you will get one dorsal digital vein. Dorsal digital vein will form dorsal metatarsal vein. Again here on either side, like this. The dorsal digital vein, it will form the dorsal metatarsal vein. Now this 1, 2, 3, 4 dorsal metatarsal vein will join to form dorsal venous arch. Now on either side of this is the thumb. From thumb there is another vein like this and another vein like this. These two veins are known as marginal vein. So on the medial marginal vein, on the lateral marginal vein. Now this lateral marginal, this is the medial marginal vein, will join with the medial end of the dorsal venous arch and will form great saphenous vein. The great saphenous vein will be formed by the medial end of the dorsal venous arch, and on the medial aspect of the foot and is coming medial marginal vein, they will join and form the great saphenous vein. This great saphenous vein, generally it is in most cases it passes in front of the medial malleolus. প্রত্যেকের পায়ের দেখবি তোরা দেখতে পাবি, এটা খুবই প্রমিনেন্ট ভেন। দিস গ্রেট saphenous vein will pass anterior to the medial malleolus. তাহলে medial malleolus এটা এবার এখান থেকে আসবে এরকম হবে, রাইট? medial malleolus, then it will cross, after coming it will cross the medial surface of the tibia. Then it will cross the medial surface of the tibia on the lateral third medial surface tibia cross করে, it will goes behind and near the knee it will pass posterior medial aspect of the knee. Then again it will come forward on the thigh. It will again come forward on the thigh and ultimately it will pierce the cribriform fascia. What is cribriform fascia? There is a fascia on the saphenous opening. There is a saphenous opening on the upper medial aspect of the thigh. That opening is covered by a sieve-like sieve-like structure that is called cribriform fascia. So it will pierce the cribriform fascia and then it will enter into the, ultimately it will enter into the which vein? Femoral vein. And before opening into the femoral vein, again it will has to perforate another fascia, that is which fascia? Femoral sheath. Femoral sheath, you have you know femoral sheath, actually the middle compartment of the femoral sheath contains femoral vein, that you know. And most medial compartment of the femoral sheath contains, suppose this is the, you have already seen in your femoral triangle dissection, suppose this is the femoral sheath. This is the femoral sheath. It is divided into 3 compartments. এটা হচ্ছে symphysis pubis. It is the medial, the lateral, right? Now this lateral compartment, this compartment contains femoral artery. Medial by intermediate compartment contains femoral vein, and most medial compartment contains one deep inguinal lymph node. One deep inguinal lymph node, that is called cloacoid gland. That is called cloacoid gland, cloacoid. And some lymph vessels and some areolar tissue. Cloacoid. Gland. Right? So, if this contains femoral vein, so when the great saphenous vein will come to open into it, it has to pass through this femoral sheath. Before opening, it has to pierce 2 structures. First cribriform fascia and then femoral sheath, then it will open into the femoral vein. Everything clear though?
The spelling of the first fascia.
Huh?
Spelling of the first fascia.
Cribriform. Cribriform. এইরকম ভাবে থাকে একটা, there is an opening like this. There is an opening like this on the upper medial part of the deep fascia, that is called fascia lata, and this this fascia is covered superficially by a sieve-like structure, ফুটো যারা বাংলা জানিস তারা ফুটো আর কি জালের মতো, হ্যাঁ, that is called cribriform fascia. So that should be pierced by long saphenous vein, right? Now this saphenous vein is provided with many valves. Within it there are many valves. Why? You know, it is a very long vertical structure. If blood is passing through it, there is chance of falling down backflow. That's why to prevent this backflow, it is provided with valves. That is called venous valves. There are 15 to 20 venous valves throughout the length of the great saphenous vein. Suppose this is the one part of the great saphenous vein. The valve will be like this. It will allow blood to move upwards. When that blood will try to regurgitate or come down, it will close, right? So that's why it is provided with these valves. Now, if due to prolonged standing, what will happen? If this valve ruptures, then the blood will come. That blood will again regurgitate, come down, and there will be engorgement of the blood, and this engorgement of blood actually will distend the vein, and that condition is known as varicose, right? Now, so first of all you have to describe how it is formed. তাহলে ফর্মেশন হচ্ছে medial dorsal venous arch, medial and the dorsal venous arch joins with the medial marginal vein, and it forms the beginning of the great saphenous vein. That saphenous vein actually will go to the thigh, and it will enter into the saphenous opening. Before entering to the saphenous opening, it has to pierce the cribriform fascia and then femoral sheath, and ultimately it will open into the femoral vein. And then it will be continued, femoral vein will be continued as external iliac vein, and this external iliac vein will unite with the internal iliac vein, and they will form common iliac vein. Common iliac vein on both sides will form inferior vena cava. So in this way, venous blood will go upwards towards the heart, right? Apart from this, there are other tributaries. তাহলে আমি একটা আঁকছি এরকম হবে। The femoral vein, this is great saphenous vein. Great saphenous vein. Why called saphenous?
Because it's opening in the saphenous opening open.
Why it is called saphenous? একটা point বলেছো। Why it is called saphenous? Saphenous means easily seen. It is a Latin word. Saphenous means easily seen. And this vein is easily seen. That is called great saphenous vein. When it will come to your use as a doctor, when you will suppose doing your internship, pulse, venous pulse कैसे देते? There are so many veins. Why you will go there? or intravenous saline.
It's superficial, it's easily located or visible.
There are many veins here, so we're easily located. Then why will you go?
Sir, it will be more bioavailable.
Huh?
More bioavailable.
Sir, because it will supply all other things.
Generally, this vein is required in which condition? Suppose one patient came to the ward with burn, মানে whole body burn. বুঝতে পারলি তো? পুরো burn হয়ে গেছে. Then
Medial cubital vein is not visible.
that vein is most constant in position and it is easy available. So then you will utilize. This is the one condition. Another condition, patient came with shock. Patient has lost so much fluid, the patient is in shock condition. Then all veins will collapse. দেখতেই পাবি না, কোনো vein দেখতে পাবি না. No vein is seen, available. Then you will try this vein. Venesection. You will cut here and you will get the vein and you will introduce your cannula and then you will start saline. That's why it is most important. It is one of the applied importance. If you are required to state the applied importance, one applied importance is a venesection. Second applied importance is this vein is utilized for sometimes for graft. You know, in artery, if there is in heart, if coronary artery is blocked and bypass operation, this vein is utilized for bypass operation. Then one thing may happen. If this vein is contained within it the veins valves, then this valve may block the passage of the blood. Then what will you do? समझ में आया मेरा क्वेश्चन?
Passage of blood block.
उसमें तो valves है, and if you place in such a way that when the blood is passing, that valve is causing obstruction, then what will you do? Suppose this vein, here there is valve like this. Valve. Here there is valve. Now you placed in such a way that the blood is going from this end to that end. Then it will block. Suppose you place this valve in heart surgery in such a way that when the blood is going from this end to that end, it will cause block. Then what will you do? সার্জন কী করবে? সার্জন ভেন তো খুব ভালো ভেন একটা পেয়েছে, সুন্দর ভেন, হ্যাঁ, প্লেস করতেই দেখে এই প্রবলেম, দেন কী করবে? কমন সেন্স, ইট উইল চেঞ্জ দ্য ডিরেকশন। এই চেঞ্জটাকে এদের ঘুরিয়ে দেবে, ইট উইল চেঞ্জ দ্য ডিরেকশন, একে দিয়ে এই ডিরেকশন করে দেবে, বুঝলি? দিস জাস্ট সিম্পলি রিভার্স, হ্যাঁ, ইট উইল রিভার্স দ্য ডিরেকশন। বুঝতে পারলি ব্যাপারটা? তাহলে দ্বিতীয় সেকেন্ড ইউজ ইজ ফর graft, for bypass the blocked artery, it may be used. And is there any other use? Other use for to draw blood or to venesection, I have already talked about it. So these are the utility of this vein, great saphenous vein. Now in our limbs there are three kinds of veins. One superficial vein, one deep vein, and another is perforators. Perforator means which structure it perforates. Why it is called perforator? Perforator means it perforates the deep fascia and it connects the superficial vein with the deep vein. Deep vein means the veins which lie deep to the deep fascia. Superficial veins means that vein which lies superficial to the deep fascia. When any vein connects the superficial vein and deep vein, it has to pass through deep fascia. Then we will call that connection is perforators. There are about five perforators along the great saphenous vein. There are five perforators along the great saphenous vein. One is at the level of the adductor canal. Suppose here the adductor canal, it may at the lower third of the thigh. So one perforator lies at the level of the adductor canal. That perforator is known as Hunterian perforator. Hunter's canal, Hunter's canal. So this perforator is known as Hunterian perforator. There are five perforators. একটা হচ্ছে Hunterian perforators. যদি না মনে থাকে সিম্পলি বলবি অ্যাডাক্টার ক্যানাল পারফোরেটর। নাম্বার 2, just below the knee there is another perforator that is called Boyd perforator. Boyd, B-O-Y-D, Boyd's perforator. Or if you cannot remember this name, you will simply say below knee perforator. Below knee perforator. There are 3 perforators along the medial aspect, just around the ankle. Around the ankle, there are 3 perforators. They are known as cocket perforator. Cocket. এটা একটা আর এটাকে বলে cocket. C-O-C-K-E-T-T. Cocket's perforator. একটা তো কালি নেই রে। Perforators. Perforators may come as the short note also. Perforators. So these are the perforators. Now you have to see this perforator connects which veins. At the level of the adductor canal, it connects the great saphenous vein within the adductor canal. Which vein lies? Deep vein. Which deep vein lies within the adductor canal? Adductor canal is यहाँ पे, adductor canal तो और नीचे. Simply femoral vein. It will connect femoral vein with great saphenous. This is called Hunterian perforator. Right. Now come to the below knee perforator. Below knee perforator. Here you see suppose this is femoral vein. Femoral vein. Here you will get, before that, let us discuss about some deep veins. কতগুলো deep vein নাম বল? What are the deep veins? কতগুলো নাম বল, একটা হচ্ছে ফিউরাল ভেন, আর কি কি ডিপ ভেন আছে? ডিপ ভেন্স, হোয়াট আর দ্য ডিপ ভেন্স? একবার ওয়ান হচ্ছে ফিউরাল ভেন, হ্যাঁ। এভরি আর্টারি আর ডিপ আর্টারি অ্যাকম্পানিড বাই ভেন, দ্যাট ইজ কল্ড ডিপ ভেন্স। ভেতরে যতগুলো আর্টারি পেয়েছি ডিসেকশনের সময়, দ্যাট, হ্যাঁ, পপলিটিয়াল ভেন, তারপরে অ্যান্টিরিয়র টিবিয়াল ভেন, posterior tibial vein, femoral vein, popliteal vein, peroneal vein, all are the example of deep vein. And on the dorsum of the foot there is a deep vein, that is arteria dorsalis pedis specialis, arteria dorsalis pedis, মনে আছে? মনে নেই? arteria dorsalis pedis, পড়িসনি? arteria dorsalis pedis, এটা হচ্ছে তোর জাস্ট anterior to the ankle. Anterior to the ankle, if you feel the pulse, you can feel the pulse of the arteria dorsalis pedis. এটা তোর এতে you will get it in surface marking or spotting, it is given. এটা ইম্পর্টেন্ট এই কারণে, suppose the operation is going on at the upper part of the body. Sometimes anesthetist is standing at the leg side, then he sometimes feel the pulse of the arteria dorsalis pedis, or posterior tibial, anterior tibial, or arteria dorsalis pedis. Sometimes you maybe this vein is required in case of one important disease, that is Burgess disease. There is a Burgess disease, is a very painful condition where artery gets obliterated, and patient maximum time, patient in hospital at the time of admitted condition, the patient may do suicide. So severe pain that patient cannot tolerate, may suicide, and it is generally found in case of chronic smokers. So here you may be required to feel the pulse of the dorsalis pedis, and here you will feel that there is no pulse sensation on the dorsalis pedis. কোনো পালস পাবি না ডরসালিস পেডিসে, কারণ তার আর্টারিগুলো সব ব্লক হয়ে গেছে, বুঝতে পারলি? তাহলে এখানে এবার this is the popliteal vein, femoral vein. The vein will be popliteal in the popliteal region. Now, here I am drawing another vein that is called this vein. It is called posterior tibial vein. From posterior tibial vein, one peroneal vein is arise like this. The peroneal vein, and this is the posterior tibial vein. Here I am drawing great saphenous vein. Great saphenous vein. Here you will get another vein that is called posterior arch vein. A posterior arch vein gulo ki, here I have already told you there are 3 perforators around the ankle. These 3 perforators, they will join. Suppose 1, 2, 3. These 3 perforators actually drain into the, they will drain into the posterior arch vein. These 3 perforators will join the posterior arch vein. তাহলে এটা হলো posterior arch vein. Now you will be, suppose what are the tributaries of the, in case of vein generally we call it tributaries, and in case of artery we call branches. Now what are the tributaries of the great saphenous vein? What are the tributaries of the great saphenous veins? What? Tributaries ki? What are the tributaries? Femoral triangle পেয়েছিস তো, At the time of discovery of the femoral triangle, দেখেছি কিন্তু তিনটে tributaries. Inferior extremity তো ডিসিশন তো হয়েছে, তাহলে সুপারফিশিয়াল এক্সটার্নাল পুডেন্ডাল, সুপারফিশিয়াল সার্কামফ্লেক্স ইলিয়াক, সুপারফিশিয়াল এপিগ্যাস্ট্রিক, এই তিনটে তো দেখতেই পাওয়া যাবে। এবং তার সাথে ইট ইজ অ্যাকম্পানিড বাই আর্টারি, superficial artery. There are 3 superficial external pudendal. They will pass to the pudendum or external genitalia. Superficial external pudendal. Here lies the genitalia. So here you will get like this. This vein will pass like this. Superficial external pudendal. Superficial circumflex iliac. It will pass like this towards the anterior spine, and another superficial vein will pass like this above. That is called superficial epigastric. So these are the superficial vein, and each vein is accompanied by artery of the same name, right? So these are the 3 tributaries. নিচে যেটা vein form হয়েছে যে দুটো vein দিয়ে, the 2 veins always there will be some formative veins, that is called formative tributaries. তাহলে here formative tributaries কি? dorsal venous arch and medial marginal vein, they are the formative tributaries. তাহলে এখানে দুটো হলো, this is the formative tributary, dorsal venous arch and medial marginal vein. এখানে মিলে তিনটে। There are so many veins, there are so many tributaries. Actually you have to describe the main prominent tributaries you will discuss. Here you will get in the thigh, you will get একটা tributaries will be, that is called anterolateral tributaries, anterolateral vein of thigh. In the thigh you will get anterolateral vein of thigh. এখানে আর একটা vein পাবি posterior vein of thigh, posterior vein of thigh. নিচে এসে এখানে পাবি lateral vein of the leg. Here you will get lateral vein of the leg, and another tributary I discussed, that is the posterior arch vein. So these are the tributaries, right? Now perforators. There are 2 kinds of perforators: direct perforators and indirect perforators. What is called direct perforators, or which is called indirect perforators? Well, direct perforator কি হবে? Suppose this is the deep vein. This is the deep vein. Deep vein means this is the deep fascia. So deep to deep fascia, deep vein, right? Now this is the superficial vein. This is the superficial vein, superficial to deep fascia. When they are directly connected, like this, that is called direct perforator. That is called direct perforator. Indirect perforator. Indirect perforator is, suppose there is a muscle here. This is the muscle. This is muscle. Here within the muscle there is the venous capillary আছে, তো here is the deep fascia. Here is the deep fascia. This is the muscle. Within the muscle there is a vein. This vein is draining into the vein. It is a deep vein. As it is lying deep to the deep fascia. Here is a superficial vein. Now this superficial vein, after piercing the deep fascia, they are joining the vein within the muscle. বুঝতে পারলি তো? তাহলে এই যে ডিপ ভেনটা, দিস ডিপ ভেন আসতে গিয়ে it has it has passed through the veins of the muscle. So it is indirect perforator. Clear হচ্ছে indirect perforator কাকে বলছে? Direct perforator দুটো vein deep and superficial directly connected. But here it is connected, superficial vein, superficial to the deep fascia, and it is also deep vein as it is deep to the deep vein. But in the intervening, there is another vein, that is the vein of the muscle. So through this vein of the muscle, it is connected. So it is called indirect perforator, right? Here also you will get valves. Valves like this. Valves actually always it will open from the superficial to the deep. Vein সবসময় opening হবে from superficial to deep. তার কারণ which one is most efficient for the carrying blood towards heart? Superficial vein is most efficient or deep vein most efficient? For carrying blood from the periphery to the heart, which vein? Superficial vein is most efficient or deep vein is more efficient? Simple logic.
Everyone.
That is within deep, there is muscle is contract, muscle is squeeze. Muscle is squeeze. যদি মাসেলের মধ্যে থাকে ভেনগুলো, যখন মাসেল যখন কন্ট্যাক্ট করছে তাহলে কুইজ করছে, আর কুইজ করলে তো খুব ইজিলি ব্লাড চলে যাবে। সুপারফিশিয়ালি কোনো কি আছে কিছু, হয়তো রাইট টাইমে উঠে আসতে হচ্ছে, বুঝতে পারলি তো? সেই যে ম্যাক্সিমাম হোয়াট হ্যাপেন্স ফ্রম দ্য সুপারফিশিয়াল ভেন, ইট থ্রু দ্য পারফোরেটেড গোস টু দ্য ডিপ ভেন, আর ফ্রম দ্য ডিপ ভেন্স ইট গোস টু দ্য হার্ট। বুঝতে পেরেছিস? ম্যাক্সিমাম টাইম হোয়াট হ্যাপেন্স from superficial vein it goes to the deep veins, and from the deep veins it goes to the heart. Because there is a pumping action of the muscle. You know that the calf muscle is called peripheral heart. Why? Calf muscle is called, soleus muscle is called peripheral heart. Why?
It has veins that supply to all the body parts.
Venous sinus আছে এখানে. It is rich in venous sinuses. Calf muscle, especially the soleus, there is numerous venous sinuses. It contains blood. When that calf muscle will contract, it will squeeze the blood and it will enter into the heart. That's why it is called peripheral heart. If you are required for prolonged standing, sometimes you have to like this. Why? If you do like this, it will contract and it will help venous return. Otherwise, you may fall down due to vasovagal attack. Vasovagal attack. দেখবি দাঁড়িয়ে থাকতে থাকতে ভিড়ের মধ্যে দপাস করে আমাকে পড়ে যায়, কেন? ভাসোভাগাল অ্যাটাক হয়ে গেল, ব্লাড তুলতে পারছে না, হ্যাঁ, পেরিফেরি এসে অ্যাকুমুলেট হয়েছে ব্লাড, তাই সেই জন্য মাঝে মাঝে এরকম করতে হবে। হ্যাঁ হ্যাঁ, বন্ধ না হয়ে যায় বা ইট উইল হেল্প ইন ভেনাস রিটার্ন, অ্যান্ড দেন উইল বি মানে দের উইল বি রেগুলার সাপ্লাই অফ ইউর ব্রেন। বুঝতে পারছো? So these are the direct and indirect perforators. Now there are some tests. Before that, before completing the systematic way যদি আমি বলি, তাহলে first of all you have to describe formation, that is dorsal venous arch and medial marginal vein, then other anterior vein of the leg, posterior arch vein of the leg, then anterolateral vein of the thigh, posteromedial vein of the thigh, and upore tinta tributaries, superficial external pudendal, superficial external iliac, and superficial circumflex iliac, and superficial external pudendal. There is another pudendal vein, that is deep external pudendal vein. There is deep external pudendal vein where it dents. It dents in the saphenous vein, but at which level? These three superficial external pudendal veins at the upper part of the thigh, they open just before the great saphenous vein opens into the before piercing the cleavage of fascia. তাহলে যেখানে ক্লিভিজ অফ ফাশাকে পিয়ার করছে তার জাস্ট উপরে এটা ড্রেন করলো, বুঝতে পারলি? সুপারফিশিয়াল এক্সটার্নাল পুডেন্ডাল, সুপারফিশিয়াল সার্কামফারেন্স ইলিয়াক অ্যান্ড সুপারফিশিয়াল এপিগ্যাস্ট্রিক, দে উইল ড্রেন জাস্ট before piercing the cribriform fascia. Even now it has perforated cribriform fascia, but just before draining into the femoral vein, there the deep external pudendal vein will drain. That's why it is called deep. Deep means deep. It's a deeper structure. সেই জন্য একটু ডিপে গিয়ে ড্রেন করছে, মানে জাস্ট বিফোর ইট ওপেনিং ইন্টু দ্য ফিউরাল ভেন সেখানে করছে ডিপ তোর এক্সটার্নাল পুডেন্টাল ভেন সেখানে ড্রেন করছে, বুঝতে পারলি তো? এবার আর একটা ভেন আছে, দ্যাট ইজ কল্ড that connection between the lateral thoracic vein and superficial epigastric vein. There is a connection between lateral thoracic vein কোথায় পেয়েছিস? lateral thoracic vein টা কোথায় পেয়েছিস তোরা? Where have you found?
Yeah, it's in the lateral side.
lateral epigastric vein বুঝে গেছিস? lateral epigastric vein, lateral epigastric artery কোথায় পেয়েছিস? lateral thoracic vein,
Certus anterior.
lateral thoracic artery কোথায় পেয়েছিস?
Certus anterior.
এখানে যে অ্যাক্সিলারি আর্টারি কি ব্রাঞ্চ? অ্যাক্সিলারি ব্রাঞ্চ কি রে? ফার্স্ট পার্টের এক, সেকেন্ড পার্ট 2 and থার্ড পার্ট 3. ফার্স্ট পার্টের কি ব্রাঞ্চ?
Lateral thoracic artery. Thoracic artery.
superior thoracic. First part superior thoracic. Second part 2 branches. They are known as acrothoracic and lateral thoracic. Third part
posterior, anterior, superior, circumflex, anterior,
আর থার্ডটা কি? हाँ तो 2 हो गया कि एंटीरियर ह्यूमर सर्कमफ्लेक्स, पोस्टीरियर ह्यूमर सर्कमफ्लेक्स।
लॉन्गेस्ट যেটা সবচেয়ে
হ্যাঁ
যেটা সবচেয়ে লংগেস্ট
সেটা কি? সাবস্ক্যাপুলার আর্টারি আছে?
হ্যাঁ সাবস্ক্যাপুলার
সাবস্ক্যাপুলার তার তিনটে। ওই যে ল্যাটারাল থোরাসিক, the lateral thoracic is connected with superficial epigastric vein. This connection is important. Why? এই কানেকশনটার কথা আমি কেন বললাম? হ্যাঁ, why this anastomosis is important?
Sir, when blood flow is stopped in the this anastomosis in the scapula, na? That superficial.
Here you see, this is the vein of the upper limb. This lateral thoracic vein is upper limb vein and superficial epigastric lower limb vein. So it is direct connection between the lower limb থেকে upper limb direct connection. If there is any obstruction, ভেতরে যদি কোনো obstruction হয়ে যায়, পেটের ভিতরে কিছু obstruction হল বা এখানে, তাহলে এই vein it will come এখান থেকে, বুঝতে পারি? তাহলে it is the direct connection between the superficial vein, মানে superficial extremity, superior extremity and inferior extremity direct connection এটা। এই জন্য এটাকে বলা হয় থোরাকো, ল্যাটারাল থোরাসিক তাহলে থোরাক, আর এটা সোফিয়াল এপিগাস্ট্রিক থোরাকো এপিগাস্ট্রিক ভেন। তাহলে থোরাকো এপিগাস্ট্রিক ভেন sometimes you may be asked in question, what is the connection of veins between upper extremity and lower extremity? That is the connection. So তাহলে এইগুলো গেল তোর tributaries. Now there are some tests. There are some tests by which we can diagnose at which level the vein has been blocked. Because of the blockage of the vein or due to the incompetent valves, this condition arises, that is varicosity. Why varicosity occurs?
Blood standing.
So standing,
Sending the valves.
incompetent of valve or rupture of valve. And number two, if there is any blockage, if within the vein, blood has coagulated, thrombosed, deep vein thrombosis. You may have heard the name, deep vein thrombosis. Then it will occur. Now, you have to diagnose at which level this block has occurred. How will you diagnose that? Number one, Trendelenburg test. একটা টেস্ট আছে Trendelenburg test. Trendelenburg দুটো টেস্ট আছে, একটা হচ্ছে তোর ওই মাসলের, হ্যাঁ গ্লুটিয়াস ম্যাক্সিমাস এখানে মাসলের পেলভিসের, আর একটা হচ্ছে এটা Trendelenburg test. How to perform this test? Trendelenburg test, how will you perform? Number one, first of all, patient will lie down. He or she will raise his leg. This will allow the vein to drain into the femoral vein. Now you will place your finger on the opening of this saphenous opening. Saphenous opening. Now you will ask the patient to stand quickly. Patient will stand up quickly. Then you will release the finger. You will release the finger, and if you see, the vein is filling quickly from above downwards. If you see the vein is filling from above downwards, then what conclusion you will draw? It is normal condition. There is some incompetent valve. Which valve is incompetent here? Here there is a valve. Another valve is there. I forgot to mention, that is where the vein is opening into the femoral vein. There is a valve that is called saphenofemoral vein. Where femoral vein opening into the great saphenous vein opening into the femoral vein, there is a valve that is called saphenofemoral valve. If that valve is incompetent, due to the release of the pressure, it will quickly fill up from above downwards. That means this valve is incompetent. বুঝতে পারলি? এটা একটা টেস্ট। নাও এবার কি করতে হবে, এবার আমি দেখব যে whether perforator is incompetent or not. I will maintain my pressure here and will see the vein is filling or not. If the vein is filled from below upwards, if the vein is filled from below upwards, then what conclusion will you draw? Normal. कैसे नॉर्मल? हम तो नॉर्मल बताया था कि सुपरफिशियल से जनरली ब्लड जाता है डीप वेन की तरफ, या तो सुपरफिशियल की तरफ आ रहा है, then how will it be normal condition? বুঝতে পারলি ব্যাপারটা? নর্মাল কন্ডিশনে জেনারেলি নর্মাল কন্ডিশনে ম্যাক্সিমামই কি হয়, ফ্রম সুপারফিশিয়াল ভেন, blood from superficial vein passes to the deep vein, and from deep vein then it goes to the heart. Here I am maintaining my pressure, and I am seeing the vein is being filled up from below upwards. That means perforator, there must be some perforator is incompetent. Perforator is incompetent, that's why from the deep veins blood is coming towards the superficial vein. বুঝতে পারলি? তাহলে perforator is incompetent. এইভাবে আমি কনক্লুশন করতে পারি। তাহলে by doing the Trendelenburg test, I can diagnose two conditions: whether saphenofemoral vein is incompetent not, that I can diagnose. তাহলে প্রথমে কি করলাম, I will ask the patient to raise his leg to drain the blood. Then after draining the blood, I will press the where it is opening, but that is the saphenous opening. I will ask the patient to stand up. And then I will release my pressure and if it quickly fills from above downwards, then I will draw conclusion that the saphenofemoral valve is incompetent. In another condition, I will maintain the pressure for 1 minute, and I will see if I see the vein is being filled from above, from below upwards. That means some perforator is incompetent. That's why blood from the deep vein is going to the superficial vein and is trying to drain into the through the superficial vein. In this way, you can. Another test is the Parthis test. একটা আছে Parthis test. Parthis test কি করা হয়? One tourniquet, one rubber tube is tied along the at the level of the saphenous opening. Saphenous opening কে বেঁধে দিলাম। Now, এবার পেশেন্টটাকে you will ask the patient to walk, and you will see the what is happening. If the vein becomes engorged, dilated, then what conclusion will you draw?
Low blood flow.
Here I have tied tourniquet. Then I ask the patient to walk. Now I saw that the veins has become engorged. That means the test is positive. It is called, that means test is positive. Now what conclusion will you draw? Where pathology lies? At which level abnormality lies? If it is normal condition, what will happen? Suppose normal condition, then blood will pass from the superficial vein to the deep vein. From deep vein, it will go to the heart, so there will be no engorgement. If the patient is normal, there will be no engorgement. That way is blocked. Blood is not being permitted to pass through the deep vein. Deep vein, তাহলে deep vein thrombosis হয়েছে। If there is deep vein thrombosis, that will not occur. তখন blood will try to follow the superficial vein. গ্রেড সাপের ভেন যাওয়ার চেষ্টা করবে, and it will engorge. তার মানে এটা দিয়ে আমি কি করতে পারি যে there is a deep vein thrombosis. This thing will, if you keep it in your mind, then everything will be clear. Generally, blood, what happens? Some blood is passing through the superficial vein, and some maximum blood is passing from superficial to deep vein, and from deep vein it is going to the heart. That is clear. Now I am placing over here. I am main grand trunk road. I am block করে দিলাম আমি। হ্যাঁ, এটা তো grand trunk road। হ্যাঁ, তাই না? grand trunk road ये ब्लॉक हो गया। बंगाली भी तो थोड़ा सीखना चाहिए ना उसको। तो grand trunk road is blocked. Now blood will, if everything is okay, if one block is not sufficient to engorge the vein, because everything is okay, now this blood will go through the perforators and will go to the deep vein. From the deep veins will go to the heart. So there will be no engorgement in normal condition. If it is an abnormal condition, if I pressure maintain over here and it is an abnormal condition, then there will be engorgement of blood. If there is engorgement of blood, then I will conclude that the perforators, either perforators is blocked or the deep veins is blocked. That's why blood is trying to come through the great seven as well. So there has been engorgement. Clear हुआ? So एक टेस्ट है जहाँ पे टूर्निकेट ट्राई करने के बाद जो करता है उसका पार्थीज, PERTHES, पार्थीज टेस्ट। और ये टेस्ट था जो हमने फिंगर्स से ब्लॉक किया, दैट इज कॉल्ड टेंडेलेनबर्ग टेस्ट, राइट? सो दीज आर द टू टेस्ट। सो কোশ্চেন অফ দ্য কি এসেছিল এবার তো
হোয়াট ইজ টেন্ডেলেনবার্গ টেস্ট?
হ্যাঁ, তাহলে এটা টেন্ডেলেনবার্গ টেস্ট ছিল। আর কি ছিল?
আর ছিল ভেনাস ড্রেনেজ অফ দ্য ওয়ালি।
হ্যাঁ, নিয়মিত হয়ে গেল।
আর ওই ক্লিনিক্যাল কেসটা ছিল যে একটা কন্ডাক্টর অনেকক্ষণ ধরে দাঁড়িয়ে আছে।
হ্যাঁ, ওটা ক্লিনিক কন্ট্রোল তো ওটা ডায়াগনোসিস হয়ে গেল ভ্যারিকোজ ভেন। প্রথম ভ্যারিকোজ ভেন নিয়ে দেন ইউ উইল প্রেসক্রাইব দ্য সুপারফিশিয়াল।
ছিল চারটে ছিল।
There is another, apart from this Grand Trunk road, there is another small road, that is small saphenous vein. Small saphenous vein. That small saphenous vein is formed by lateral end of the dorsal venous arch and lateral marginal vein. এখানে this is the dorsal venous arch, this is the lateral end, and এখানে lateral marginal vein will form the small saphenous vein, and that small saphenous vein generally passes behind the lateral malleolus. It will pass below the lateral malleolus and will go behind the back of the leg. First it will lie on the lateral aspect of the tendo Achilles, then it will come just midline posteriorly, then it will go at the level of the popliteal fossa. It will pierce the popliteal fascia and it open into the small saphenous popliteal vein. That is called small saphenous vein. Slowly, small saphenous vein is accompanied one nerve, cutaneous nerve, that is called sural nerve, and great saphenous vein is accompanied by one cutaneous nerve, that is saphenous nerve. That saphenous nerve lies anterior to the great saphenous vein. Here it will lie like this. So when you will do venesection, when you will try to do venesection, you should keep it in mind that there is a saphenous nerve. So you should try to save the saphenous nerve. Saphenous nerve যদি বেঁধে দিস তো কি হবে? What will happen? Saphenous nerve তো your junior doctors you may do some wrong. Saphenous nerve-টাকে বেঁধেই দিলি, কি হবে? ক্ষতি খুব হবে? কি ক্ষতি হবে? Foot drop. What will happen if saphenous nerve is injured? When paralysis will be done, I have already told you it is the cutaneous nerve. Cutaneous nerve never produce paralysis. If cutaneous nerve would paralyze, the surgeon would not be able to do any surgery. তাহলে every cutaneous nerve তাকে সেভ করতে হতো. He has to save every cutaneous nerve. সব সেভ করো, ঘাস করে কেটে দেয় সার্জন, ঘাস করে কেটে দেয় সব cutaneous nerve. There will be some loss of sensation, cutaneous sensation for some time. बाद में साइड से जो है और जो nerve আছে সেগুলো গ্রো করে তৈরি করে দেবে. It will overcome the deficit. সেরকম কিছু হবে না, হলো? তাহলে ইন শর্ট আরেকবার আমি বলে দিই, এখানে হচ্ছে how great saphenous nerve vein is formed. It is the dorsal venous arch, medial end of the dorsal venous arch joins with the medial marginal vein and forms the great saphenous vein. That saphenous vein passes in front of the medial malleolus. Very important. That great saphenous vein passes in front of the medial malleolus. Then it crosses the leg at the lateral third, lower third. Then it goes towards the back of the leg, and it goes to the on the back of the knee, and then it again comes in front of the thigh, and ultimately it opens into the. Ultimately it goes through the cribriform fascia of the saphenous opening, and it will ultimately drain into the femoral vein. Now this is the longest vein in our body. It is provided with some perforator veins, that is 5 perforators mainly, and also it has got within it there are about 15 valves within it, 15 to 20 valves. And now tributaries is niche hoche, that is the anterior leg vein, posterior arch vein of the leg, upore thigh ache anterolateral vein, posterior medial vein, and just before piercing into the cribriform plate there are 3 tributaries. Circumflex iliac, superficial circumflex iliac, superficial epigastric and superficial external pudendal. And before entering into the femoral vein, another vein tributaries, it dents, that is the deep external pudendal vein. Now the valves কোথায় কোথায় থাকে? একটা valve, most important যেটা valve, at the beginning of the just where it is draining into the femoral vein, there lies the valve that is called saphenofemoral vein. Another vein is there, that is the, suppose this is the, here lies the saphenofemoral vein, this is the femoral vein, when it will cross this dead line, this is the inguinal ligament, then it is known as external iliac. External iliac আবার একটা ভালভ আছে, বুঝলি তো? External iliac আবার ভালভ থাকে একটা। External iliac valve also contains a valve, that is খুব important. In 20% cases, this valve remains absent. If this valve remain absent, so then there will be direct pressure will fall on the saphenofemoral vein. এই ভালভটা থাকার জন্য এখানে একটা extra advantage it got. If this valve is not present, then direct pressure will fall on the saphenofemoral vein. Hello? Now perforators. Which perforators? Perforators means the veins which connects the deep and superficial vein by perforating through the deep fascia. There are some important perforator is একটা হচ্ছে Hunterian perforator, lies at the level of the adductor canal. One lies just below the knee, that is called Boyd perforator. Another lies around the ankle joint. 3 perforator, that is Cocket perforators. এই perforatorগুলো আছে, বুঝতে পারলি? তারপরে ক্লিনিক্যাল কন্ডিশন অ্যাপ্লাইডে বলবি যে ভ্যারিকোসিটি ইজ দ্য মোস্ট ইম্পর্টেন্ট। আর ইম্পর্টেন্স হচ্ছে এটা তো ডিজিজ হলো, আর ইম্পর্টেন্স হচ্ছে দিস ভেন ইজ ইউটিলাইজড ফর grafting, venous graft in case of cardiac surgery, and it is utilized in case of venesection. In collapse condition, when there is no vein available, we generally utilize this vein. হয়ে গেল।